Yeah, our residents get introduced to the OR in their junior year, but they actually start performing real cataract surgery during their intermediate year. And I work with them during this comprehensive block. And so it's a perfect time also to do some one-on-one wet lab time. And so particularly at the beginning of the year, we want to focus on getting our intermediate residents ready for the OR. And so this one-on-one wet lab practical time allows us to work on sort of work on filling any gaps in theory, but also in the theoretical knowledge of the steps of cataract surgery, but also to try to put that into practice a little bit. This allows us to help the intermediate residents improve their skills outside of the OR so that they'll be particularly ready when they come into the OR with me. This allows our residents in turn to be able to make the most out of their time on the block. So during the intermediate year, our residents are working towards performing full cataract surgeries. Usually by the end of the year, or even before that, we're having intermediate residents doing most or entire cataract cases. And so this time that I spend one-on-one is really helpful to sort of help get the intermediates up to speed. And so, the wet lab's always open. Fresh pig eyes are being delivered every week. So we have a ready supply at any time. And I basically, during one of these sessions, I walk the resident through setting up the Faecal machine so that, you get an understanding of the machine, but also so that you can come and really practice on your own as well. Pick out the instruments and work through a full phaco case, starting from making the wounds and doing the rhexis to doing the phaco and the INA all the way to the end of the case, and even injecting a lens if we have time for that. I also like to spend time after the OR reviewing cases, reviewing videos of the cases that we did together with our residents. So I think this having this facility really allows us to really help the residents make the most out of their time actually in the OR.
Yeah, so I really enjoy these sessions. It's I get to know the residents, and I feel like I'm being useful to them in their surgical careers. The way it works is I get the first year residents for 2 or 3 two-hour sessions where it's one-on-one, and I proceed through a series of steps. I like to start them out with very simple maneuvers like conjunctival piridomy, suturing conjunctiva, closing sclerotomies, the same thing that Dr. Young was talking about before. I try to work on the basic skills of actually just suturing and tying knots. And then when we move on next, I like to use an eye model to teach them the basics of lasering. So do indirect ophthalmoscope laser of retinal tears, panoretinal photocoagulation, that kind of stuff. And that's often really appreciated by the residents because they get to play with the machines. They get to try them out on an eye model where you can actually see your burns are taking place, and it simulates pretty well the real experience. And then lastly, if there's enough time, I really like to take the residents to the IC surgical simulator, which is a fabulous piece of machinery. Most people think of it as a cataract simulating machine, but apparently it was actually developed as a vitreoretinal machine, and it is incredibly lifelike. When you get in the eye, you can practice peeling membranes off the retina and doing lasering of retinal tears and stuff, and it's fabulous. And so those are the 3 different broad areas I cover. And in addition to actually just learning the skills and getting to know the instruments, I like to talk about the theory of, what causes retinal detachments? How would you fix a retinal detachment? Why do you suture in a rotational way so that you don't bend the needle? Why do you follow the track of the suture needle, et cetera, et cetera? And I like mixing up the actual hands-on skills with the theoretical background all at the same time. And I find that a lot of fun. And I think it works out very well.
I think on one hand, we can divide up those one-on-one sessions into the scheduled sessions, the spontaneous, and sometimes the less expected sessions that you can have. So as for the scheduled sessions, the session with Dr. Kilstra is one of the highlights of being a resident here. You also get to know Dr. Kilstra as a wonderful human and person, which is just a wonderful thing. Getting to do, I agree, the IC experience with peeling epiretinal membranes or ERMs, and getting that experience is just really fun. Lasering, and it does feel shockingly lifelike. After having now gone to the OR and done some lasering, it is just a really helpful experience having done it before and not feeling like you're practicing on a person as much. I think those are just incredible sessions. As for the less scheduled, when I was an intermediate, Dr. Wang was not doing cataract surgeries. I was with Dr. Lowe. And before going in and doing some of my first phacos with her, we kind of said, why don't we just go to the wet lab, see where you are? And I think it'll make us both feel more confident going in with an awake patient to say, here is exactly the skill level and show me how much you've practiced and show me what you've done. So I felt so much better than going in the first day, being able to say, look at what I've practiced, here's what I can do, show me your techniques. And I felt like I had more preparation and more confidence going into that day. And lastly are the unscheduled, or the less conventional, in that before my glaucoma rotation, I met with reps from the Cahook dual blade, the Zen gel stent, the eye stent, and was trained on each one of those. So that way I could go right into my glaucoma rotation, and I did 3 Zens, 3 eye stents, I did 7 Cahooks, and was able to just hit the ground running and do those procedures. So I think you can use it in so many ways. The reps love getting to come in and show you things, and will come at any time of day, and it's always open. So it's a lot of opportunity there. And lastly, with the IC is a great adjunct to pig eyes, which I'll make a plug too. You don't have, like Dr. Wang said, you don't have to order the pig eyes. They're always available. You don't have to have the foresight to plan your OR or your surgical training. You just can go in and practice. But the IC can give you good practice with things like a capsulorhexis, which a pig eye isn't as realistic with. So you get a really nice balance depending on which media is more realistic.